Many people, women and men, seriously think about plastic surgery, but stop short of taking action. And a big reason is that people are afraid of the unknown. Dr. Michael Venemeyer joins me today to discuss some of the myths and misconceptions regarding plastic surgery. He's also the author of a book, Plastic Surgery Myths Dispelled. Nice to have you here, Doctor.
Thank you, Gail.
And there are so many myths and things. Why did you decide that it was important to author a book like this?
Well, these days there's so much misinformation out there about plastic surgery. People hear things from their friends and coworkers, on the internet, from potentially unreliable sources. So I wanted to set the record straight.
What did you talk about in here that you think is most relevant to what people need to know about plastic surgery?
Well, one of the biggest myths out there is that plastic surgery is just for the rich and famous. I think that plastic surgery is something that's attainable for everyday people.
Okay, we're going to play a little game of fact or fiction. Let's start with liposuction. Should you remove all the fat possible? Is that a good or bad thing?
That's a bad thing and complete fiction. With liposuction, you actually get a better result if you leave a little bit of fat behind. When you think about Michelangelo carving the statue of David from a solid block of marble, the result consisted of the rock that was left behind. The chips of stone on the floor were completely irrelevant, and the shape of the final statue was everything. So, in other words, the fat that remains gives you your final shape.
So you still need to have a little bit of fat in there to give that a little bit of shape. Okay, let's see next. You kind of hit on this before, but people are scared because they say it's not affordable.
Correct.
And you think that's a myth?
It is a complete myth. In fact, statistics from the American Society of the Plastic Surgeons reveal that 71% of cosmetic surgery patients make less than $60,000 a year. So whether people pay cash, use cosmetic surgery financing, or credit cards, plastic surgery really is attainable for nearly everyone.
Okay, last one. There are folks that say, you know what, you're working on that outer beauty, but really it's inner beauty that counts. You say it's both.
I do. Despite the critics saying that plastic surgery's benefits are only superficial, there are some recent studies that show otherwise. Some studies suggest that the benefits of plastic surgery may include improved self-esteem, improved body image, a better social life, and even a better sex life.
So you think then that once they feel better about themselves, they have more confidence and the rest of them blossoms as well?
Absolutely.
Okay. Botox, fillers, all those things are considered topical. You don't really call that plastic surgery, correct?
Well, it falls within the realm of plastic surgery, but we call it minimally invasive.
Okay. Well, where do you fall? Where does minimally invasive work for some folks? And when you recommend that next step where you go under the knife?
Mm-hmm. Well, certainly minimally invasive treatments will never match the results of surgery. But what they're good for is a mild to moderate improvement temporarily with minimal downtime. But to get big, longer-lasting results, you have to go to an invasive procedure.
Well, and it's interesting. You sent me some before and after pictures of some of your procedures, the ones that are surgical. And I will say that people look very natural looking. They look like themselves, only a little bit better. And here's some examples. Do you have a philosophy on how you talk to your patients as to what their expectations are when they're done?
I do. I always try and have natural results because, as you said, a patient wants to look like a younger version of themselves. People do not want the stereotypical facelift appearance. So I do everything that I can to avoid that. And part of that is that I use a very artistic approach when doing my surgeries.
What do you mean by that?
Well, I approach the person's face with trying to make them actually look like a younger version of themselves, moving the fat back where it came from rather than just pulling everything back and tighter. Tighter is not necessarily better. It's all about shape.
And is really the goal for not someone to look at you and go, oh, they had work done, as opposed to, oh, you look rested?
Exactly. That would be the goal.
But then some people say, okay, if I don't do it extreme, it won't last.
Well, that's not necessarily true. In my opinion, if you do the procedure properly and tighten the right places, you can get long-lasting results that also look very natural.
Well, we've just hit, the tip of the iceberg on some myths and misconceptions, but your book is available. How can folks get it?
It's available on Amazon.com. That's probably the easiest way to find it.
Well, Dr. Venemeyer, it's a pleasure to meet you, and thank you so much, and cruising through this book is very interesting. Thanks a lot. Nice to have you here.
Thank you, Gail.